So weight loss medication semaglutide, Ozempic, Wegovy has recently gained popularity. A lot of patients are on this medication for weight loss or diabetes or both. Although these are the excellent medication for weight loss and for diabetes, there are certain things you should know before starting semaglutide. So here is the 5 things that you should know before you start semaglutide. The first one is the timeline. You have to understand that it may take few weeks to months before you start seeing improvement. This medication has to be titrated up, meaning you start on the lower dose and then you titrate it up to the higher dose. If you are a patient that start losing just on the smaller dose, then you may start seeing the improvement in your symptoms sooner than if you are a patient that don't feel anything until you are at the higher dose. So timeline may differ from patient to patient. The second thing is the side effect of heartburn and nausea. This is one of the very common side effects with these medications. Hydration while on this medication is key. So if you are not drinking enough water even before starting the medication, then you should start drinking enough water before starting this. Now, if you already have a symptoms of heartburn or any other history of gastric ulcer, make sure you talk to your provider before starting this semaglutide. The third is constipation. This medication delays the gastric emptying, which causes constipation. So if you are already suffering from constipation, you should start increasing the fiber in your diet and also maybe add magnesium to your supplement line to improve the symptoms of constipation. Because once you start this medication, the constipation is going to get worse. So hydration, fiber, and maybe magnesium is the key to improve this symptom. The fourth is muscle loss. So this medication is excellent for losing weight, but along with losing weight, you may also end up losing muscle, which is not a good thing because it will slow down your metabolism in the long run. So while you're on this medication, you should increase the protein intake and start exercising regularly. And the last one, the fifth one, this is the fun one. Before you start this medication or when you start this medication, people will judge you for taking this medication for weight loss. Initially, because of the stigma of being on medication for weight loss, everybody will judge you. And then few months later, after seeing your result, they'll ask you how they can get started with this medication. Thanks for watching. Hope you learned something about optimizing your overall health. Talk to your medical provider before starting any treatment. Let us know what other topics you want me to cover. Give us a thumbs up if you like the video and subscribe for more videos.